multidisciplinary approach. Pediatricians, dermatologists, psychologists, and nutritionists must work together to provide a holistic care in these disorders. We all agree that education and awareness are equally important. So, adolescents must be encouraged to embrace skin health through hygiene, nutrition, stress management, and avoiding misinformation about harmful beauty trends, because that's often that we see. And being a someone who's always interested in nutrition, I can vouch that health hygienes like nutrition and also your lifestyle stress, as well as sleep hygiene, all this can make a difference, because people talk about lactose, milk, etc. I can't gather as dermatologist and Bansalji and the other who are doing this. Once again, I would congratulate Nima Bindu along with a lovely team who have chosen such a beautiful topic, which is extremely important for an adolescent, both physically, mentally, socially, and in the mindset. Thank you, and best wishes for a rocking event.
Thank you so much, Neelamji. Thank you. Unmute, Shyam.
Thank you, Dr. Neelam Mohan, for those lovely words of encouragement. I will now request Professor M.K.C. Nair to put in his 2 words of encouragement for all of us today.
Good evening to all on 25th anniversary of Adolescent Academy, and my greetings to the President Himabindu Singh, Neelam Mohanji, all the other dignitaries on and off the webinar site. I would say 3 reasons why dermatology is so important. One, because when you say dermatology, there is also cosmetology along with it. And that is a part that adolescents like most. Even my grandchild, who is 9 years old, I think she spent a lot more time on making up her face than other thing. I can show her here. Come, 1 sec. Huh? Always doing makeup. Okay, this is the girl. Okay, even at that age, they start doing cosmetology. That is number one reason. Number 2, skin is the most important part for a neurologist, because most of the diagnosis they make from the skin. If you look at immunologists or rheumatoid, all those people who are dealing with immunology related, again they look at skin as the thing. Apart from the usual routine skin infections and manifestations, so I think it's very important. Fungus most important in the hot humid climate of India. Fungal infections, so a lot more things to be told. And last but least, Dr. Dayal Agra would vouch that most of the even sophisticated community also may have leprosy. That is one message I think we need to say. It's not the poor people who all have leprosy. Even the very rich and so-called sophisticated, clean sort of people also would have leprosy. So the whole program, dermatology and cosmetology, become important. And I'm sure the learner speaker is going to enlighten us on this. Thank you. Thank you so much.
Thank you, sir. Please be with us for your expert comments, sir. Thank you.
Thank you, Dr. M.K.C. Nair. As usual, you've always highlighted what would be the essence of the forthcoming webinar, and you've touched upon the important points that need to be discussed today. Thank you so much, sir, for your encouragement. I would now proceed to request our first speaker, Dr. Smita Murli Nair, to get ready with her presentation while I introduce her. Dr. Smita Murli is a consultant in pediatrics, pediatric dermatology from Taluk Hospital, Kunnamukkulam in Thrissur, Kerala. She is the chairperson of the Pediatric Dermatology Chapter for 2024 and 2025 IAP Kerala. She's been a faculty in pediatric dermatology in various national and state pediatric and neonatology conferences. She has contributed to the Pediatric Dermatology Workshop module as a coordinator from IAP Kerala and has also contributed to the Pediatric Dermatology chapter on IAP OSCE textbook. A very, very warm welcome, Dr. Smita Murli, and welcome you to our talk. We are really looking forward to your talk. So please go ahead and share your screen.
Thank you very much, sir. Respected Himabindu ma'am, Chairperson HA. Sir, am I audible?
Yes.
Yeah.
Respected MKC Nair, sir. My teacher at Trivandrum Medical College. I'm an alumni of Trivandrum Medical College. Then respected IAP, dear friends. So all the introduction has been done beautifully by Neelam ma'am and MKC sir regarding the importance of pediatric dermatology. And I'm basically adolescent dermatology. And as pediatricians, we have very less exposure to dermatology. So I really found working in IAP as a pediatric dermatology after my MD dermatology, I think it is a very wanted subspecialty in pediatric dermatology. And I'm blessed, and thank you very much, Himabindu ma'am, for giving me this opportunity to speak in this to speak to this August audience. I'm blessed. So let me start my presentation. So all the introduction has been done by Neelam ma'am. She has given a beautiful introduction for my topic. My topic is basically practical tips that I'll be discussing, not much of a scientific thing. It's like practically what we just need to know about teen skin and teen skincare.
Dr. Smita, Dr. Smita, you can do the slide share. Yeah.
That's fine.
Yeah.
Can you make it full screen?
As adolescence, as Madam told, it's a transition from childhood to adulthood, and this transition is marked by significant physical, emotional, cognitive, and changes. So coming to physical development, the hormone changes. The hormonal changes lead to physical growth spurts, sexual maturation, and development of secondary sexual characteristics happens in the adolescent, and synaptic pruning and myelination impacts the cognitive and emotional regulation in the adolescent. So the release of the gonadotropic releasing hormone from the hypothalamus, it sets in this physiologic, the changes which happen in puberty. It leads to the release of FSH and LH from pituitary, and it acts on the gonads, and which produces testosterone, estrogen, and progesterone, which causes the skin changes. Also is caused by these hormones. So testosterone is the main hormone responsible for the skin change in puberty. So testosterone causes increased sebaceous gland activity. It causes this oily skin seen in our teens. There is increased apocrine sweat gland activity, which can cause body odor. The terminal hair starts developing from the vellus hair. So that is contributing to the secondary hair growth in the axilla and pubis. And even the hair growth, the density and thickness of the hair grows because of the effect of testosterone. And the menstrual hormonal fluctuation also causes premenstrual exacerbation of the pre-existing skin conditions in like psoriasis, eczema, so chartly sexual maturation, but testosterone also has a role to play in the development of mind. It helps to maintain a feeling of well-being. It influences the cognition skills. It increases aggression, anxiety, it decreases anxiety and depression. So its testosterone is not only on sexual function, but also on the mind and also in the body. It helps to maintain healthy bones. It stimulated the muscle growth, stimulates the hair growth, etc. And in the function of testosterone in females, it improves in brain, it improves the spatial memory. Then in breast, there is the breast, in the development of the breast, in the muscles and bones. Even it wards off anemia. And the main thing related to dermatology, it augments the collagen content and improves the texture of the skin. Now, what happens to the skin microbiome in puberty? In puberty, usually in the childhood stage, it's usually Streptococcus, Staphylococcus, the colonies which colonize the skin. But when in puberty, the skin starts colonizing with lipophilic bacteria, that is QT bacterium, that was earlier known as Propionibacterium, and Corynebacterium, Turicella. All these lipophilic microbiome starts colonizing, and this helps in the sebum production. And this reduces the skin pH, and it also inhibits the growth of pathogenic Staphylococcus and Streptococcus in skin. So the main factors which affect an adolescent skin are genetics, the hormonal fluctuation, the lifestyle habits, that their diet, exercise, sleep, etc., and other environmental factors like pollution, UV exposure, etc. So what are the skin conditions which can happen at puberty? Due to the raised androgen levels in the puberty, it heralds the start of genetically programmed familial characteristics, that is male pattern baldness, hirsutism, hyperhidrosis, bromhidrosis can start during the puberty. And other skin conditions which are seen in puberty are acne, seborrheic dermatitis, pityriasis versicolor, hidradenitis suppurativa, Fox-Fowler disease, that is an apocrine gland disease, and polymorphic light eruption, psoriasis, etc. So that was a short about the adolescent skin. Now coming to the main part, the skin care routine. What are the skincare routine we should practice? So I'll be talking on skincare, hair care, nail care, some makeup and beauty tips, and about aesthetics and self-care. So coming to the skincare. So first is that we should know our skin type. How can we know our skin type? So cleanse our face, and after 1 hour, just feel the skin. Is it dry, flaky and tight? It means it's a dry skin. If it's oily and shiny, it means the skin is oily. Then there is a combination skin, that is, it's oily in the T-zone. T-zone means over the foreheads, the nose and the mouth, that area, T area. That's called a combination skin. The cheeks will be dry. And a normal skin, which is not very oily or dry. And there is the sensitive skin type, which is has inflamed skin. So this is how you know our basic skin type. And depending on the skin type, we can have some skincare routines. So for a normal skin, this skincare routine can be followed. That is, in the morning, we can cleanse the skin with a gentle cleanser. Then soon after cleansing, we have to moisturize with a lightweight moisturizer. Then we have to protect our skin with a broad spectrum sunscreen. So sunscreen is a very important. The UV radiations are the one which causes the photo aging of the skin. And if we start early, especially during adolescence, it has an anti-aging effect because it will reduce the photo aging. So how to choose a sunscreen? Basically, 2 types of sunscreens are available. We have the chemical sunscreens and the physical sunscreens. For children, we prefer physical sunscreens. That is, sunscreens which contain zinc oxide, titanium oxide. Many sunscreens are available in the market. Cosmetologically good aesthetically looking sunscreens are available in market for children. And the other sunscreens available are the chemical sunscreens. So in chemical sunscreens, we look for the SPF factor. sun protection factor 30 plus. That means that the sun protection factor means the protection against the UVB. UVB rays are the one which causes sunburn. So to prevent sunburn, we have to choose a sunscreen with SPF 30 plus. SPF 30 plus is enough because it will cover 97% of the UV radius will be UVB will be protected from 30 plus. There is no, like if it's 50 plus, it's just like 98%. So that's not much of a change. So SPF 30 plus is well and fine. Then there is another factor which we have to look while choosing a sunscreen. That is the boot star rating. That is for the UVA. So 3 plus or more. That is it is needed for the UVA, protect against the UVA. So UVA rays, they just enter the dermis and cause aging. These are the changes entering the dermis and causing aging changes. So when you choose a sunscreen with SPF 30 plus to protect against UVB, and boot star rating of 3 stars or 4 to protect against the UVA rays. And we have to wear a sunscreen half an hour before going out in the sun. And now, like, water resistant sunscreens are available in market, so we needn't reapply after sweating and all. But if we are using a normal sunscreen, if we sweat, we'll have to reapply that sunscreen. So that's a short about sunscreen, which is a must for all skin types. And avoid going out in the time period of 9 a.m. to 3 p.m. when there is the maximum UV exposure happening. Now, skincare of acne-prone skin. We can use a cleanser containing salicylic acid or benzoyl peroxide. And in acne-prone skin, after cleansing, we have to use the treatment. Acne medication need to be applied. After that, we have to moisturize using a non-comedogenic moisturizer and use a sunscreen with SPF 30 plus, which is oil-free and non-comedogenic, broad spectrum. These sunscreens are available. Sunscreens for oily skin are available in the market. Now, for sensitive skin, use a cleanser with this fragrance-free. Fragrance is a allergen, contact allergen. So always use a fragrance-free gentle cleanser for sensitive skin type. And a moisturizer should be hypoallergic and fragrance-free. And a broad spectrum sunscreen of SPF 30 plus should be used. So additional tips for skincare: wear sunscreen daily, avoid picking and popping pimples, keeps hand away from the face, stay hydrated, and get enough sleep. Now coming to hair care, daily hair wash is not advised. Washing 2 or 3 times a week is sufficient. And they advise like wash hair when it is dirty. And overwashing can strip our hair of its natural oils. Avoid excessive brushing. Shampooing, apply only to the scalp, prevents stripping of your hair of its natural oils. And conditioner is a must after shampooing to lock in the moisture and to avoid tangles. And if you're using heat styling, keep temperatures moderate and use heat protectant sprays. So some hair care habits which can damage the hair are shampooing the length of the hair and skipping conditioner, drying hair by rubbing with towel or using heat equipments, brushing wet hair, tight hairstyles, regular hair coloring, perming, strengthening and relaxing, applying long-lasting hairstyling products, and wearing hair extensions. Now, about some words about nail care. Keep the nails clean and dry. Trim nails straight across. Avoid biting and picking at nails. Wear gloves when washing dishes, gardening, and using harsh chemicals. Use nail polish removers sparingly. And if the nails are brittle, moisturize with nail oils and creams. And if nails are weak, you can use nail hardeners. For thick nails, you can use nail files or drill to thin it. And when you choose a nail care products, when you choose a nail polish, choose formaldehyde-free options. Nail strengtheners containing keratin or calcium are available in market for thin nails, and nail moisturizers are also available in market. So avoid excessive exposure to water or chemicals, and you can wear nail stickers, and for the diseased nails, you can use nail supplements containing biotin. Some makeup tips for teens. So keep it simple, focus on enhancing natural features, choose hypoallergic and fragrance-free products, avoid heavy foundation, lightweight, oil-free formulas should be used, highlight your eyes, use mascara and subtle eyeshadows, define the brow, groomed brows frame the face, wash hands before applying makeup, remove makeup thoroughly before bedtime, and exfoliate your skin once or twice a week. So that is about the skincare. Now all the skin problems will be detailedly taken in the panel discussion. So I'm just going through some common skin related issues. So some skin related issues we commonly see in adolescents are acne scars, hyperpigmentation, and hair problems like dandruff, hair loss, frizzy hair, split ends, unwanted hair growth. And they have body image concerns with the body shape and size, weight issues, stretch marks, scars. So for acne vulgaris, just a few things. Cleanse gently. You can use a toner or astringent to close the pores after cleansing. Then apply the acne treatment and medications, and then apply a moisturizer or gel followed by the sunscreen. So a short note on the acne treatment. So basically we can classify the acne into three types: mild acne containing comedones, then mild to moderate where there are papular and pustular lesions, and severe acne whereas there is severe nodular cystic acne with scars. So for mild acne where there is no evidence of inflammation, the initial therapy should contain topical retinoids or benzoyl peroxide, and a topical antibiotic need to be used only if there is evidence of pustules or infections or inflammation. Then in mild to moderate acne, we can choose combination therapy with retinoid and antibiotic, which can be topical or oral antibiotic. And in severe acne, we use systemic therapies with like isotretinoin or hormonal therapy in women. So these are the initial therapy. And in the after the successful initial therapy, we need to go to a maintenance therapy, and make sure that in the maintenance therapy, always use retinoids or benzoyl peroxide. No antibiotic should be used in the maintenance therapy to prevent antibiotic resistance. So a short note on the acne scars. So acne scars, we have to see if it is erythematous. The acne scar, the treatment available are vascular lasers like pulsatile lasers, etc., IPL. And if the scars are atrophic, there are three types of atrophic scars: ice pick scar, box scar, and rolling scar. So for ice pick scar, the common thing which we can do are punch excision and cross technique. Cross technique is we apply chemical peels over that scars, and there will be healing occurring and collagen production will happen. And other therapies available are lasers, microneedling, RF, etc. For box scars, again, they are somewhat deeper scars. So for individual treatment, we use fillers, punch elevation procedures, cross techniques, etc. And lasers, microneedling, RF are also available. Other for superficial shallow scars, we use dermabrasion and chemical peel. Rolling scar is again another type of scar. Again, all these treatment modalities like substitutions, injectable fillers can be used in individual, and lasers, microneedling, dermabrasion, chemical peels can be also used for the treatment. Now coming to dandruff, which is another common complaint in adolescents. So for mild cases, we can just use antifungal shampoos containing cycloperox, ketoconazole, and keratolytic shampoos if there is excessive plaque formation with salicylic acid shampoos are also available in market. Coal tar in severe cases can be used. And we also give topical corticosteroids for application for mild to moderate cases. And for severe cases, oral systemic antifungals, systemic antibiotics like doxycycline and azithromycin, which have anti-inflammatory properties, are used along with topical corticosteroids and shampoos. Another important complaint which a adolescent presents to the clinic is hyperpigmentation. This can be post-inflammatory hyperpigmentation and tan and sun, exposed to sun, UV radiation. Then certain hormonal fluctuations can also cause hyperpigmentation. So in a, as a prescription thing, what we give are lasers, chemical peels, tretinoin, hydroquinone, azelaic acid, etc. And at home remedies are also there with the we have a lot of home remedies available. Other thing what we give with prescription are retinols, vitamin C, kojic acid, etc. Now another important complaint which comes to a clinic is androgenetic alopecia. Nowadays, like in this, because of this lifestyle changes, all this androgenetic alopecia has started coming in at teenage itself. A lot of boys come with their temporal recession, complaint of temporal recession and the loss of hair over the vertex. So topicals, what I personally give are hair serums first, because hair serums containing redensyl procapil, all these are hair growth natural contents which can help in which can help in strengthening the hair roots and bringing the hair loss, bringing down the hair loss a bit. And other medical therapy, what we can give are topical minoxidil, finasteride, latanoprost, which are available. And in severe cases, we might need oral medicines like finasteride, minoxidil, etc. So this is what I told about the hair growth serums, which are which we are now using more before minoxidil itself. All these pumpkin seed oils or palmetto, melatonin extract, caffeine extract, all are available in hair growth serums in market. And they have studies have shown that they were effective in treating androgenetic alopecia. Another important condition affecting our adolescents is this PCOS syndrome. And we all know the clinical findings of what we see in PCOS. In dermatological wise, it's acanthosis nigricans, obesity, hirsutism, which presents to the clinic. So, as all the other conditions will be taken up by the panel discussion, so I'm just winding up. So, the common challenges our adolescents face are the pressure to wear makeup. They have unrealistic beauty standards, comparisons, and difficulty in finding suitable products for their skin type and makeup related issues. And other, the social media impact is also causing a lot of stress to our youngsters. So there is low self-esteem, anxiety, depression, all these disorders are seen in adolescents. So I would say this skincare routine, they can be adopted as a part of self-care for us. Makeup can be used as a self-expression, hair care as self-love, and mindful fashion choices. All these routines can be used for self-care. And the tips to parents: we maintain open communication with the adolescent, foster self-acceptance, encourage independence, and model healthy habits and behaviors, monitor social media usage, and seek professional help. So for teens, practice self-care, focus on inner beauty and strengths, surround yourself with positive influences, seek professional help when you need, and embrace your individuality. So thank you. So that's it.
That was wonderful, Smita.
Thank you, Dr. Smita. That was wonderful. We have a full house If this was a physical webinar, you would have had a full house applauding your presentation.
Yes,
Thank
we
you
had
for,
sessions with her earlier, and it was
yes,
all fully loaded,
yes,
even in our other sessions. Thank you. I think it was you touched both the aesthetic part and also the other parts of skin and other things. Wearing makeup is essential nowadays. What you are saying, right? Thank you. I think let's very interesting. Thank you. And we have actually exceeded 100, and maybe I hope Sharma sir, the
yes.
YouTube link is
11 persons on YouTube.
Thank you.
111 total.
Okay. So I'll summarize Dr. Smita Murli's talk by the quote that the best foundation you can wear is a glowing and a healthy skin. So thank you, Dr. Smita Murli, once again. Now we come to the most possibly interesting part of our webinar today, wherein we are soliciting the opinions of the people who matter. We have Dr. Vijay Rani with us, Dr. M. Vijay Rani. She is a very dedicated adolescent pediatrician and she is running a center known as Sneham, which is a guidance center for children and adolescents. She has held a lot of important positions in the IAP. She's been a past secretary, past treasurer of the IAP North Arcot chapter, a past ED member of the IAP Tamil Nadu State branch. She's been a South Zone coordinator of the AHA and has also presided over as the president of the AHA in North Arcot in Vellore. So she's a very academic person also, has contributed chapters for the Mission Kishore Uday, was a national faculty for MKU, has contributed review articles, has been a faculty in TOT's chapter on parenting, and has also received the Active Pediatrician Award of the IAP Tamil Nadu State Chapter. So we welcome Dr. Vijay Rani, and I will request her to moderate this particular session, which is probably our most attractive session, wherein youth voices would contribute to the deliberations today. So over to you, Dr. Vijay Rani. Please introduce the youth voices and then we can proceed.
Thank you for your kind words, sir. And let me start with my pranams to our professor, Dr. MKC, sir, who was also my teacher. And also thanks a lot to Dr. Hima Binduji, our chairperson, and her excellent team, and all respects to the senior colleagues who are in this team. Without wasting time, I would like to, and it's also a privilege for me to join this Youth Voice in this Silver Jubilee session. I'm seeing there beaming Manyata and even Pavan, who had been very cooperative, and I'm very thankful to their parents who have allowed to join our sessions.
Yes,
So
thank you.
let's start with
Thank you so much.
Manyata. She is an 8th standard student from Kharwar, and let's start with her. Manyata, are you able to hear my voice? You can unmute, yeah.
Yes, ma'am. I'm able to
Yeah,
hear your voice.
yeah. We are all very happy that you people are here, and let's have your voice. So can you tell us how you start off with your skincare? So we'll all listen to you.
Ma'am, first of all, I'm thankful for all of you for contacting us and
Yes.
letting us participate in this wonderful webinar. The presentation that was showed by Smita ma'am, it was really amazing. I also got to know different things which I didn't know about, and they will most probably help me in the future for taking care of my own
Wonderful.
body.
Yes.
Wonderful.
So it's not, I don't do much of things when it comes to taking care of my skin. All I do is I just apply a face wash, use
Yes.
talcum powder, and then apply a little moisturizer as and when required. Like whenever I feel my skin's too dry, I use the moisturizer. That's it.
Excellent. And Pavan is a BTech student, first year. We would also like to know what you do for your skincare, the routine.
Yeah, and thank you, ma'am. Thanks for your valuable opportunity to me. And I wish good evening, good night, good evening to all the doctors who are present here. And thanks for giving a valuable opportunity to me to speak about our skin case and our youth's voice also. And I'll take very care about my skin. Why? Because if a small pimple it is there also, I can't go outside and I can't talk to my friends and I can't talk to my teachers and everyone in the society or in the college. So I'll take care of my skin, applying the ointment and the face wash and using some gel, etc., which is suggested by dermatologist. In our place, dermatologist, Dr. Harsha Garu, uh, we will go for checkup to him and we will guide. In his guidance, we will be using that medicine. And mainly a hair fall and a dandruff is very common issue in the youth. And whereas Smita ma'am tell that very valuable words about that our skincare routine, and how to improve our various techniques also ma'am has been teach to us in this session. I'm very happy that to hear that that all, and I have few of questions to ask you ma'am. Can I ask?
Yes. Meanwhile, we will ask Manyata, where does she get her information from? Does she see Instagram, Facebook for her skin tips?
I don't, browse Instagram or Facebook because I don't have accounts.
Okay,
The only social media account that I have is of YouTube, which I'm using my mom's account. So
very good.
there, like sometimes whenever I feel bored when I study, I just scroll through those shorts, and there I see the skincare tips, but I don't usually follow them.
Yeah.
So there was one tip. The only tip that I followed was about related to my hair because I was facing dandruff. So me and my mom, we both saw that, and we applied it to my hair. It was sort of an Ayurvedic treatment, and like it worked out for my hair.
Okay. Do you follow any healthy food eating habits for the sake of your skin and hair and nails too?
Yeah, like I do eat more of proteins and drink milk and eat curd to maintain that proper calcium balance so that my hair or my skin, my bones, everything will stay proper, and like they'll be well built and they'll be healthy. That's all I do.
Excellent. What about you, Pawan? About your food habits? I mean, do you take healthy, balanced diet?
Yeah, yes, ma'am. I'll take a healthy balance diet. Why? Because skin and hair is most important in the youth, especially in the boys,
Wow.
compared to
The
girls.
Jalika was asking one question. What for the boys? We think all the time only for the girls. So nice to hear from the boys are very conscious also, right?
More,
Yeah.
yes, ma'am. Boys are more interested to take care of their skin, and they are usually going to the doctors and meeting usually to the doctors, ma'am.
Okay. So we have here many specialists here, experts, with whom you can actually share your concerns and ask questions. So Pawan, you had some questions. You may ask now.
Yeah, yes, ma'am. I have some questions. Is there any permanent cure for psoriasis disease, ma'am? Why? Because my friend is suffering with psoriasis disease. Uh, with that, he can't go even on face. It is having a rashes like that. So while he's showing his face, he's feeling somewhat shy to face the other audience in the society or in the college itself, ma'am. Why? Because when he met the doctor, he said that there is no permanent cure for that psoriasis disease. Is there any cure for that, or any temporarily only it is having? This is my question, ma'am.
Yes. I would request Dr. Smita ma'am to answer his question if she's in the
Yes,
place.
yes, yes,
Yeah.
ma'am.
Yeah.
Yeah. Again, what the doctor told was very correct. Psoriasis is a chronic disease. It has its remissions and exacerbations. It has a lot of medications are available. Like you have to moisturize your skin daily, and when there is any breakout, when there is any breakout, like exacerbation happening in psoriasis, we have topical corticosteroids ointments are available in market. You can see your dermatologist and they can prescribe it. And there are some triggers also, like infections can trigger. Then usually we don't give oral steroids for psoriasis. Oral steroids worsen psoriasis. So if they take steroids, it can like worsen the psoriasis, etc. There are a lot of medications, immunomodulators, what we call, which are available now, and newer safer therapies like biologicals have coming in the market. Now it is like costly treatments, but now the insurance companies are providing this. Insurance companies are helping in this biological therapy. So and now the technologies. I mean, the science is also improving a lot. Means it's a newer discoveries are coming. So in the near then with the genetic therapy, everything might be coming. But right now there are biologicals which are very promising in psoriasis. It's a bit costly, but it's a near control is available with biologics. So no 100% cure as of now. It can happen in future, but as of now, good control measures and treatments are available. Yeah.
Thank you, ma'am. Thank,
Moisturizing is very, very important in psoriasis and most of the skin diseases. Yeah.
thank you, ma'am. And Pavan, I think you can be very supportive to your friend. Also tell him that he needs to be under the guidance of the dermatologist. And ma'am has given you some important thing what he should do. Maybe you can tell him.
Yes, ma'am. Thank you, ma'am.
Thank you.
Actually, my video I can't see.
It's okay. It's okay. Manyata, you have any concerns?
Yeah, I'm not concerns as of such, but like whenever I, speak with my friends during school time or during the lunch break, I often come across them saying that like, they use extensive makeup products for, maintaining their skin and all. But I have, done my end of like reading articles about them, and what I have deduced is that they have a lot of chemicals in them. So
Yes.
when they have so much chemicals in them, like, is there any alternative for those harsh makeup products which we can use to maintain our skin properly?
Good. Thank you. Ma'am, can you answer
Yes,
her, ma'am?
yes. And this a lot of contact dermatitis to this dyes which are used in the makeups, even lipsticks, and the kumkums, all your foundation. Lot of cheap chemicals are being used, and it is causing contact dermatitis. Lots of cases I've been seeing. So use a product. There are lot of allergy-free, hypoallergic products available, which contains no parabens. Parabens are
Yeah.
they are this preservative like thing used, and these are the contact allergens.
Mm.
So you when you choose a product, you choose a hypoallergic paraben free products when you choose a makeup product. And choose a product depending on your skin type. Like if you are a normal skin, oily skin, everything has separate beauty products are available. Choose a good brand. It might be a bit costly, but it will be safer for your skin. Lot of cheaper lipsticks and powders, etc., are available in market. Beware of them. Just don't go because for that. And use something which you are comfortable with. You are like normal products also, even talcum products which you are usually using will do fine. And what I told you, like um, I told you some tips like having a good brow, do your brows well, keep do some eye makeup. No need for heavy makeup. And if you are have a pimples, and these makeup products can block and worsen your acne. So choose a lightweight moisturizer and lightweight oil free foundation. Everything is available in the market. So what I highlight is use hypoallergic paraben free products. That when you see a product, you just look for it and choose a good brand also. That's what I'll advise.
Thank
But
you, ma'am.
makeup is good if it is bringing means if it brings up their confidence. I would always say go. You can do makeups. No need to shy away from makeup. It's good, but use a good product. Yeah.
Thank you, ma'am. And what about your sleep and hydration, Manyata?
Uh,
You sleep well?
yeah, ma'am. I sleep well for around 7 to 8 hours. Like I manage to get 7 to 8 hours of sleep a day,
Yeah.
and like
Uh,
that keeps me active throughout the day.
yeah. And you drink enough water?
Yeah, ma'am. Around 2 to 3 liters of water, like I intake.
Yeah. So these are all also important for your skin. I'm
Hmm.
sure ma'am would agree with that. Yeah. So anything else? Pavan, you want to ask any more questions?
Yeah, yes, ma'am. One more question.
Yes.
Um, if we grow, I have heard that if we grow nails, the hair fall will occur as more, ma'am. Is it is correct, ma'am?
Can you be a bit louder?
Ma'am, if we grow nails, the hair
Yes.
fall will occur more in the. It will get more hair fall, ma'am. Hair fall.
No, no such thing. Ma'am, Pavan asked, if we grow nails, more hair fall will happen.
No, ma'am. No, ma'am. It's
No.
just a myth.
Yes. It's a myth. It's not true, Pavan. Yeah.
Yeah, thank you, ma'am. I heard that through my friends. So they also said that you asked this question also to the doctors. So I
Yeah.
have asked, ma'am. And
So you're truly youth voice. You have brought in your friends' concern here.
yeah, yes, ma'am. I brought questions from my friends who are suffering with this
Yes.
myth and everything, ma'am.
Thank you. I think on behalf of AHA, would like to
Yes.
thank both of you.
Yes.
Yeah.
Thank you
Thank
so
you,
much,
ma'am.
Manyata and Pavan. You may stay back and listen to the panel discussion also. Here and there, you may pick up for something useful to you. Thank you. Thank you, both of you.
Thank you
Thank
very
you.
much, ma'am.
Thank you,
Thank you,
ma'am.
ma'am.
I
Thank
found
you.
this I found this very helpful because I got new insights on how I can take care of my own skin and my hair. I'm definitely going to implement these, and thank you so much for inviting us here. It was a wonderful
Thank you.
Thank
opportunity.
you,
Thank you so
Manita.
Thank
much.
you.
Big
Thank
round of
you.
applause to both of them. Thank you so
Huge
Thank
much.
you,
round of
ma'am.
applause, yeah.
Thank
Thank
you.
you, ma'am. Thank you for
Thank
giving
you,
a
ma'am.
great
Thank you, sir.
opportunity to us, ma'am.
Very,
Thank you
very
very much.
smart and bold, and they were so good. Thank you.
Thank you, ma'am.
Thank you,
Thank
Dr.
Amog.
Vijay
Thank you,
Rani.
Amog.
Thank you, sir.
Thank
Thank
you,
you.
Dr.
Thank
Vijay
you, Amog
Rani,
also.
for a
Thank you,
fantastic
ma'am. Manita has
session.
always been a very sweet child, so she was the perfect person to get today.
Yeah, thank you, Amog,
Thank
for
you. Thank you,
Thank
having
Dr.
you.
them.
Thank you, Manita.
You're most welcome, ma'am.
So a huge round of thanks and applause to Manita and to Pavan for enlightening our discussion and lighting it up really with questions which are relevant in the adolescent practice. Before we proceed, I would request Dr. Geeta Patil, our immediate past president, and Dr. Shushma Desai, our president-elect, to just say a few words of encouragement for the efforts of everyone today.
Of the diet, which is very important for
Dr. Geeta Patil? Dr. Geeta Patil, are you there, ma'am? He is there. Dr. Geeta Patil? Okay. Dr. Shushma Desai, if she is there?
Yeah,
Yes,
I'm
ma'am,
there.
please. Yeah,
And
thank you.
it was so interesting, and the discussion was so vibrant. Just the mere presence of youth made it so interesting. Smita ma'am's presentation was so crisp and very practical. So even we got to know some new, very simple but very new things to be, given as an anticipatory advice to our adolescents in our clinical practice. And I appreciate both the youth for being so honest and coming up with so nice questions. I think that was the most appealing part of so far in this webinar. I congratulate Himaji for conceptualizing the participation of youth, and of course together we stand. So involving all the different fraternities does help. Thank you so much for giving me an opportunity. Thanks a lot.
Bindu, I think we should give a certificate to all this. The Manita has excelled.
Yes.
She has excelled all these
Please share your
participants.
email IDs. I request you both to please share your email IDs. You will receive a certificate of appreciation for our from the Adolescent Health Academy. Thank you so much. And please be part of us through the AHA Youth Forum.
Thank you, ma'am. Thank you very
Thank
much,
you,
ma'am.
ma'am.
I've already joined you in that group. Thank you.
Okay. So are you ready
Now,
for it? I'll just call you then.
I think we should be going to our panel discussion and invite Dr. Geeta Bansal ji to start the panel discussion. Dr. Geeta ji, Dr.
Hello.
Shamit, Geeta ji needs your introduction, please.
Dr. Geeta Patil, I think so. She just called me. So Dr. Geeta
Bansal,
Patil.
Geeta Bansal.
Dr. Geeta
Geeta
Patil.
Bansal.
our immediate past president, past chairperson, she just called me. Ma'am, just a few words of encouragement, ma'am.
Yes, sir. Yes, I think this is the
Is
great
there? Okay.
initiative.
Welcome you, Dr. Geeta.
It's a great initiative going on, and involving the teenagers is definitely going to understand what we are supposed to do, not just talking among each other. Thank you. Wish you all the best and going on well. Thank you.
Thank you, Geeta. Thank you.
Right. Thank you so much to our esteemed seniors for encouraging us every step of the way. To moderate our panel discussion, one of our very, very esteemed colleagues, Dr. Geeta Bansal, is all ready. She is a Master of Counseling and Family Therapy and is the Director of NSSK Kota. She's had multiple awards. She's a Karli Chakra awardee and a gold medalist. In her pursuit of adolescent medicine, she has got certificates and she has had her training certified by the Royal College of Pediatricians, by the University of Sydney, and also by the Johns Hopkins University. She has been a very prominent member in the Adolescent Health Academy, serving her second term as an EB member, and is a very, very academic person, has had almost 15 publications in peer-reviewed journals, 2 chapters in the IAP textbook, has published educational literature for the last 25 years, has been a guest faculty at national conferences, talks on All India Radio, and is also a contributor in the adolescent counseling and obesity modules and teach modules of the AHA. So over to you, Dr. Geeta Bansal, and we hope you have a very, very fruitful session today.
Thank you, Dr. Shamik, for such a kind introduction. And that interaction with adolescents was exceptionally, it was excellent and a wonderful session to do. So it's a pleasure to welcome you all to this important panel discussion on adolescent skin problems. And we are honored to have a distinguished group of pediatricians, dermatologists, as well as young individuals who can share their personal experiences and perspectives. And adolescence, we know, is a period of immense physical as well as emotional change. Skin health plays a crucial role in a young person's confidence and overall well-being. From acne and eczema to more complex dermatological conditions, these issues can impact their self-esteem as well as their daily life. So that is why today's discussion is so vital, not only to explore the medical insights, but also to understand the personal and the social challenges faced by the adolescents. So throughout this session, we aim to shed light on the causes, the treatments, and the myths. We also address the concerns about mental health, self-care, and practical solutions, as just Dr. Smita also covered some of the very, very practical solutions just now in her talk. I encourage all of you, whether a medical expert or a young person, to engage actively in today's conversation. After the panel discussion, feel free to share your thoughts and ask questions, as this discussion is meant to be informative, interactive, as well as impactful. So with that, let's begin. I would like to start by introducing our first panelist, Dr. Shilpa Bhargav. Dr. Shilpa, would you like to share your screen? Dr. Shilpa Bhargav?
शिल्पा यू अनम्यूट करो आपको अनम्यूट करो
Yes, share. Okay.
Am I audible now?
Yes, and we can see you. You can share your screen. Dr. Shilpa, I'll introduce her. She is a consultant pediatrician placed at Raipur, and she is the director at the Bluebird Children's Hospital, a developmental pediatrician with special skills in allergies and immunology. She has held various official posts in the IAP as well as the AHA. So, Dr. Shilpa, I want to discuss the problem of Arika with you. Arika is a young adolescent girl studying in class 10. Earlier, she had a very smooth and clear and a glowing skin. But lately, she has started developing pimples all over her face and her back too. And she has already tried some home remedies and many of those given in the advertisements. But the problem is still worsening, and she has now become very self conscious, worried, and anxious. Now she has come to your office. How will you approach this girl?
Thank you, ma'am. And thanks to Dr. Hima Bindu, ma'am, for giving me this opportunity. And my greetings to all the seniors and colleagues present here. So, as ma'am said, Arika came to me with her problem. So, whenever a patient, especially adolescent patients, come to our clinics, we usually have an approach towards them. First of all, we should build a rapport and address emotional concerns, acknowledge her distress, and reassure her that acne is common during adolescent. Approximately 80 to 85% of adolescent age group have this problem. And I would like to explain that effective treatments are available, and the main key is patience. Be patient and have faith in your doctor. So this, after building a rapport and addressing her emotional concern, I would like to take a clinical history and evaluation, like onset and progression. Where, when did it start, sudden or gradual? What is the severity? Like only you have blackheads or whiteheads, or you have some papules or pustules like that. As madam told, she has already tried the home remedies and other previous treatments. So I would like to take the history of that. I would like to go for some ask for triggering factors like stress. How much is the stress level of regarding some social things, or mental regarding mental health, or like studies. If she is having some hormonal changes like irregularities in her menstrual periods, or is she using some cosmetic products, what is her diet, about sweating or some occlusive clothing. I would like to ask about family history also. If, is there any history of acne in parents or siblings? After this, there comes a physical examination. So during the physical examination, we can assess the type of lesion. Is it comedons or papules, pustules, nodules, and identify any post-inflammatory hyperpigmentation or scarring. I would also like to check the signs for hormonal imbalance like hirsutism, or I would like to ask about a sudden weight gain in past 2 to 3 months, if I suspect PCOS. So the next part after physical examination comes the most important part in adolescent age group is counseling and reassurance that acne is we have to explain them that acne is not due to poor hygiene but due to hormonal and genetic factors, and emphasize avoidance of picking or squeezing the lesions to prevent the scarring. And I would like to reassure her that the plan of management which we will go for her will definitely help her. So
Okay.
plan for
So,
management. So yes,
so
ma'am.
would you like to, if tell our youngsters what factors can precipitate the acne? Because if they know the factors which will precipitate them,
Mhm.
it will help them to prevent an exacerbation to a certain extent.
Sure, ma'am. There are certain factors which precipitate acne, like Dr. Smita already explained very well in her talk about all these things. I would like to repeat it again, like some hormonal factors. In adolescent age group, there is increased androgen activity, which stimulates the sebaceous glands. In PCOS, also we have these factors. Dietary factors play a major important role in precipitating the acne, like the food which adolescents likes nowadays: high glycemic index foods, refined sugar, white bread, chocolates. These all stimulating sebaceous glands. Dairy products, especially skim milk, linked to the acne exacerbation. Some medications like corticosteroids, lithium, androgens, anti-epileptics, all these etc., or all these trigger acneiform eruptions. Apart from it, there is a psychological stress which elevated the cortisol level and which is quite evident in adolescent age group nowadays. So it can increase sebaceous gland activity. Apart from it, there are some cosmetic and mechanical things like oil-based skincare products, as Dr. Smita already told us that the skincare products are very crucial in the acne eruptions and the skin problems. Some are
So,
comedogenic.
Dr.
Hanji.
Okay. So, Dr. Shilpa, it's generally been seen that we assess the severity of acne in the office practice. Is there
Yes.
any reason why we need to do so? And how should we assess the severity?
Ma'am, usually we assess the severity so that we can categorize the acne in mild, moderate, or severe, so that we have a guide for appropriate treatment. Towards that, we have some certain guidelines to refer to some dermatologist. It is also for that we initiate the treatment early after assessing the severity, so it prevents the scarring and hyperpigmentation. And
Right.
there is psychological impact, like acne causes anxiety, depression, low self-esteem. So if we grade it and initiate the treatment early, we can do the things in betterment of adolescent. So we grade it like mild acne, predominantly comedones are there. Moderate acne, increased papules, pustules, but nodules are very occasional. And in severe acne, there is nodulocystic acne. So there is a great inflammatory lesions and there is increased risk of scarring.
Okay.
And these are some scales which or systems we can use. Commonly, we use the global acne grading system, which is based upon the lesion type and the location.
So, Dr. Shilpa, how can a pediatrician like you or me manage acne in their office practice? What are the indications for a referral to a dermatologist?
See, ma'am, when we grade the severity of acne, then we differentiate between mild, moderate, and acne treatment. So, in mild acne, as already Dr. Smita told us, that first line treatment is topical retinoids,
Yes.
and along with that, benzoyl peroxide we can use. And for hyperpigmentation, azelaic acid, ya fir kozic acid, that we can use. These are the first line treatment. For the second line treatment for moderate acne, we use topical retinoids along with benzoyl peroxide, along with topical antibiotics like clindamycin or erythromycin. There are many products available in market, and in case of moderate acne, we usually give oral antibiotics along with the benzoyl peroxide, so that there is a prevention of bacterial resistance. And in case of less than 9 years of age, we usually don't use minocycline or doxycycline. We use erythromycin in those cases, and above that we can use doxycycline and minocycline. In case of severe acne, usually we use oral isotretinoin as a first line drug, and adjunctive therapies like intralesional steroid injections, chemical peels. And for that, we have to refer the patient to the dermatologist.
Yeah,
So,
very true.
apart from it, role of adjuvant therapy is there, like proper skin care, as told by Dr. Smita. And when to refer to dermatologist, this is the very important thing for every pediatrician. See, the severe acne, the nodulocystic acne, scarring skin, we should refer to dermatologists. We should not waste the time of any adolescent for that. Refractory, those acnes who are refractory to 3 months of standard treatment, we should refer to dermatologist. Suspected hormonal acne, psychological distress due to acne, you can refer to dermatologist for a expert opinion. And if we are considering oral isotretinoin therapy, we should definitely refer to dermatologist.
So that was very nice. Do you have a take-home message for our audience?
Sure. I would like to say to those adolescents who are participating with us in this webinar that acne is common but treatable. So timely intervention is required, and it will prevent the complications and scarring. We have to assess the severity and individualize the treatment. It is not one and all for everyone. Mild acne, topical retinoids, benzoyl peroxides are used. Moderate acne, oral antibiotics can be used. Severe acne, oral isotretinoin is used. Diet and lifestyle matter a lot. We have to limit dairy products, high GI foods, and stress. Psychosocial impacts matters. Addresses emotional concern in adolescent, and we should refer early for severe or scarring acne to the dermatologist.
Okay,
That's
thank
it
you
from
so much,
my
Dr.
side.
Shilpa. And I would
Thank
request anyone, if they have any queries, to write them in the chat box. And or at the end of the panel discussion, we'll take up the queries. And you can directly ask also at the end of the session. And now I will move on to my next panelist, Dr. Abhik Sil. So, Dr. Abhik, are you ready? With this, I invite our next panelist, Dr. Abhik Sil, a very interesting person. Presently, he is posted as an assistant professor at PKJ Medical College, and he completed his MD dermatology from the now famous RG Kar Medical College. He has some very interesting awards to his credit from Singapore, New Orleans, Boston, and even in a WHO competition. A Horlicks Wizkid winner and a Bonvita Confidence champion, he has various publications in national and international journals and chapters and books to his credit. So I invite you, Dr. Abhik, to discuss the most common skin issues of adolescents. I have a case for you to discuss. Dr.
Good evening.
Abhik.
Good evening, ma'am, and thank you to all my seniors and colleagues and the young two individuals who have joined us. It's been a very interesting discussion, especially being a dermatologist. So it's always on the other side where we give lectures on how to take care of skin. Being on the receiving end is something that's pretty new. So thank you for the opportunity, and I hope to enlighten you all with my limited knowledge. Thank you.
Okay, Dr. Abhik. So Radhika is an adolescent girl, and for the past 2 weeks, she has noticed lots of hair on her pillow in the early morning. Also, when she does a head bath, she feels as if the drains get choked due to her hair. She is very worried. She is having nightmares of getting bald. And how can we help her?
Yes. So the first of all, whenever a patient comes to us, it's important to address certain factors. We need to identify whether this is a physiological issue or a medical condition that we are dealing with. So everyone having around 50 to 60 strands of hair fall daily, it's pretty normal, right? So once the physiological aspect has been explained, uh, then we can address it as a proper medical condition. Now, given the time frame that is about 2 weeks, so this is an acute phase reaction. So, whenever you're getting hair fall, you need to identify what is the diagnosis that we're trying to look at. Whether it is an effluvium, that is where you're getting diffuse hair loss, or whether it is a patterned hair loss. So, in this case, since it's a diffuse condition, you're probably looking at effluvium. Given the time frame that is less than 6 weeks in this case, so we would like to arrive at a diagnosis of acute telogen effluvium in this child. Now, once you've made a diagnosis, you need to identify what are the triggering factors possible in this case. So, the common ones would be certain dietary changes. It can be a certain sudden change in dietary habits. Crash dieting is a very important aspect. Whether there is malnutrition, be in the form of micro or macronutrients, you're not taking a balanced diet. Stress, be it physical, psychological, mental, is a very important aspect we need to ascertain. In case of adolescents, a simple thing like a change of school, a change of your friend circle, uh, a family dispute in the family, all these are very important triggering factors, because hair fall is basically a physical manifestation of some internal stress. It can be psychological, it can be a medical issue. uh, Whether the child is taking any medications. There are certain medications, long-term usage, which can lead to hair fall. Whether there are other medical conditions like if there's a thyroid issue, if there is iron deficiency anemia. So once you have made a diagnosis, It's important. Why? Because you can actually counsel the patient that this, what the patient is suffering from, is a reversible condition. And even if you do not treat this patient medically, the body itself will take care of this. This might take a couple of months, say 3 to 6 months, but the problem that you're facing right now, it will subside on its own. But you cannot let a patient go empty handed. You have to fill up your prescription. So I would probably prescribe some serums, uh, a multinutrient which would take care of the dietary deficiencies, and advice regarding general measures like trying to keep your scalp clean, try to wash your hair at least 2 3 times a week. Another important myth that should be debunked is most patients attribute shampooing the hair to as a direct causation of the hair fall. This is something that that the parents, caregivers, and teenagers must understand. It's the hair itself is already loose. When you're actually shampooing, you're just enabling the fallen of hair to become visible physically. So it's not that shampooing your hair actually causes hair fall, because if you don't clean your scalp, that itself would lead to excess sebum production. There can be grease dirt formation. You'll try to scratch. There can be secondary infections. So keeping your scalp clean, shampooing daily is one of the basic general measures that you would advise uh, to all patients.
Okay. So, Dr. Abhik, that was very nice and informative. Now I have a case of Nikhil for you. Nikhil has approached his pediatrician and wanted to speak with him alone. He says, Doctor, my girlfriend is always very annoyed with me and she gets irritated if I get close to her. I did not quite understand at first, but now she has told me that I sweat excessively and the odor is very foul and she cannot tolerate that smell. Earlier, too, my friends used to make fun of me about my body smell. I just don't know what to do. So, Dr. Abhik, what can we do to help him?
Thank you, ma'am, for the question. Now, if it is a problem that is only being faced by the girlfriend, then probably changing the girlfriend would be the immediate answer. Then another important thing to understand before we come to a medical aspect is, once you hit your teenage years, there are certain physiological changes that take place, which would lead to changes in your amount and quality of sweat. So there'll be increase in sweat formation, and also the odor that would kick in. So certain change, it's pretty normal. Once it gets to a point where it causes difficulty in your social life, it's only then I would suggest you seek professional help. You would want to take care of certain general measures like trying to take a bath daily. Taking a bath daily, it can be multiple times based on your needs and the climate that you're staying in. Try change your clothes. If you're into a lot of outdoor activities, you can even carry change of clothes, use deodorants and antiperspirants. Now, it's important that you understand the difference between the two. A deodorant would actually help you in taking care of the odor, whereas an antiperspirant would take care of the amount of sweat formation. So, depending on what is actually bothering you, whether it is the smell or the sweat or both, you can pick and choose the product that you want to use. So, say for example, if you're going out to, you're having a football match, you use an antiperspirant before the match. You can use it during the match as well. Take change of clothes, dry yourself adequately before you put on your clothes. Another important aspect is smelly feet. So I always say, even if you sweat a lot, please wear socks, right? Because if a sweaty feet comes in contact directly with your shoes, that would just aggravate the problem. Change Keep extra pairs of sock in your with you at all times, especially if you have certain issues. Once certain general measures have been taken care of, you need to see whether there are actual medical conditions that can be attributed to the sweating. whether the sweating is generalized or there are certain areas that sweat more. For example, your folds. If your acral areas, for example, if you have a lot of sweating in your hands and feet, then you would like to think of certain medical conditions. You need to look at family history because it can be primary and secondary. If you have issues with holding a pen or a pencil, giving your thumbprint, that is when you require active, dermatological intervention. Now, thankfully, we live in a time where there are a lot of interventions that are available to us in the form of medical therapy and certain injections in the form of Botox, which can lead to, long-term remissions and quality of life for our patients.
So, okay, thank you, Dr. Abhik. Now, could you tell us something about the most common skin infections in boys and girls and how to manage them? We can't hear you.
Abhik, you have to unmute yourself.
Am I audible now?
Yeah.
Yes.
Yeah. So the most common infections or infestations, if I may use a broad category, would be bacterial. So, this is the age where you're outgoing. There are a lot of hormonal changes that has already kicked in. So simple folliculitis and superficial infections like pyoderma is what we commonly get to treat. So in such cases, maintaining just general hygiene and treating the localized area of affliction with an appropriate topical antibiotic should suffice. Oral antibiotics may be needed if it is severe or if there are multiple areas involved. Second would be infestations that we come across, be it in the form of head lice or scabies. So in this case, apart from specific management, what I find is that uh, family treatment is very very important, right? Because just treating the individual would not help, because the problem itself would get perpetuated in the family and it's like a vicious cycle that plays on. So whenever we get a case of scabies or head lice pediculosis capitis, please advise family treatment of all family members. Everyone living under the roof should be treated irrespective of whether they have come with the patient or not. In case of pediculosis, always look out for secondary lymphadenopathy, lymphadenitis, because there can be streptococcus pyogenes infections which can complicate the matter as well. uh, Viral infections is something that has picked up a lot. Hand foot mouth disease is no longer limited to a certain age group. We are getting adolescents and adult patients with hand foot mouth disease. A lot of viral exanthems that come to us, which needs to be differentiated from more common mimics like drug reactions. So it's always a very difficult task for both pediatricians and dermatologists to identify whether the rash is caused by a drug or a virus. So there are certain subtle signs which can help.
Unmute yourself, Dr. Abhik.
Yes. So most common ones would be bacterial, followed by infestations, followed by viral infections.
Okay. So, can you give us an idea about when an adolescent should be referred to a dermatologist in such cases that you have taken up?
Anything from a very personal point of view, anything, if you can see it, you should refer it to a dermatologist.
Okay, so any take-home messages for our audience?
I think medical advice should be taken from a proper medical personality. Please don't trust your friendly neighbor. Please don't trust your family members regarding, medical advice. Seek professional help when you feel it is required, and trust your doctor and follow the treatment regimen thoroughly and come for follow-ups regularly.
Okay, so thank you, Dr. Abhi, for a session full of sense of humor. Very interesting. Thank you. And
Thank
now
you.
I call upon my third panelist, Dr. Kumar Divakar. He is the head of the Department of Pediatrics at Tata Main Hospital, Jamshedpur. An MD from Mumbai University, he completed his fellowship in pediatric critical care from King's College, London. He also completed his fellowship in neonatal medicine from the University of Calgary, Canada. A national instruction in the NRP program, he is affiliated to the IAP, NNF, and the IAP intensive care chapters. And he has more than 15 publications and national and international journals. So, Dr. Divakar, are you ready?
Yeah. Good evening, ma'am.
Yeah. Okay, Dr.
Thank
Divakar.
you for giving me
So
opportunity.
we have seen that most of the cases of atopic dermatitis are picked up in infancy or childhood. So how common is it in adolescence?
So, as you have rightly said, most of the atopic dermatitis will be picked up in the infancy age. However, in several, we may find it may persist during the adolescent also, but incidence in children age group is, if you go for the literature, is 5 to 20%. And as children grow, most of them will outgrow with this condition, and only few will remain with the atopic dermatitis during the adolescent group. However, if presentation is very severe in the infancy, they are more likely to persist in adolescent group, and up to 70% might persist in the adolescent group.
Thank you all.
So, yeah, so if you look at the adult incidence, around in 2 to 5%, that will be matched the adolescent group also.
Okay, so what are the differences in the clinical presentation in a child as compared to an adolescent, Dr. Divakar?
Yeah, so if you look at the atopic dermatitis development phase, so there are infantile phase, there are childhood phase, and there are adult phase. Adult phase mimics the adolescent also. So in infantile phase up to 18 months or 24 months, what we see that the distribution of the lesion are on the face, scalps, or on the extensor surface. While if we in older age group, it's a flexible surface where you see the lesions. So distribution of lesion is one which we can differentiate between infantile phase and children phase. As this is a chronic condition, you might see lichenification of the skin also during the adolescent phase.
Okay.
Got it.
So can you tell our young participants about what factors can lead to an exacerbation?
So atopic dermatitis there are two types. One is in one type what you call extrinsics, where IG